Have you ever wondered what it's like to go through a CO2 laser resurfacing procedures? CO2 is the gold standard when it comes to anti-aging laser procedures. I do a ton of this in my clinic, and a few weeks ago I did it on myself, and I'm going to walk you through what it's like to go through a laser procedure and, importantly, what the recovery looks like, because this is a procedure that has a fair amount of downtime. It's not like you can get this done and then you're back in the public the next day. When I walk you through this, you're gonna see my recovery day by day, and you're gonna see the kinds of products that I use for myself and for my patients when it comes to healing the skin up as fast as possible to get the results that you're looking for. As we start out, you can see me doing the laser procedure on myself in this time lapse. Now, I admit this is not an ideal way to do it, but I did this on Christmas Eve. There was nobody else in the office, so it's not ideal to perform it on yourself, but I did it, and obviously I don't have eyeglasses on, and that's also something that we always cover our patients' eyes when we're doing this procedure. To kind of mitigate the risk of that, I did not have the repeater on the laser, so every time it fired, I had to push down the laser with my foot, and I closed my eyes on it. I didn't get too close to my eyes with the laser, as you can see. So I've performed this a ton. I understand the risks of this particular laser and definitely wasn't going to get it in my eyes. Just to show you an example of what this looks like when we do it on other people, you can see here in this video that we all have proper eye protection on, but when I was doing it on myself, I wanted to be able to get a more thorough treatment, and wearing goggles wasn't exactly going to be the best for that. So that is what the procedure looks like. Let me tell you about CO2 laser. As I mentioned, it targets water in the skin. Our cells are full of water, so this is an ablative laser. When it hits the skin, it causes thermal damage to the tissue. It creates a hole in the skin, and the depth of that hole depends upon the power settings that you put into the laser. My particular treatment was kind of a medium depth treatment. If I was letting somebody else do this procedure, I probably would have gone much higher on the settings, and that would come with more downtime. Prior to this procedure, I did do topical numbing on my skin, and I had that on for about 45 minutes. This is a 23% lidocaine solution in a cream, really, and that really numbed the face significantly, so I didn't really have any pain as I did it. In my particular treatment, I not only treated my whole face, but particularly tried to target some of these brown spots on the side of my head, and from the before and after, they lightened significantly. So what I want to do now is walk you through the day by day so you can see what each day of recovery looks like. You can see the products that I use, and if you are going through a procedure, I recommend that you use all of the aftercare products that your performing provider recommends. But if you're looking for products that are great for sensitive skin, or you don't get clear instructions on what you should use after an ablative laser, you can use these, and I'll have them linked down in the video description. So now that you've seen my treatment, you've seen me performing that treatment on someone else, let's kind of go through the day-by-day recovery, and you can see what that looks like.
All right, so I lasered my face today with the CO2 laser and a little bit of the 1570 wavelength. You guys saw some of that footage, and I'm gonna walk you through my skincare and my recovery day by day. So you can see, so far I have not put anything on my skin other than the thermal spring water from Aven. So it's got minerals in there, it's really nice and cooling, it's sterile, it's not gonna increase my risk for infection, but spraying that water on there helps to decrease the risk of, it just makes it so it's not so hot. It just helps to pull a lot of heat out of the skin, because essentially this feels like a sunburn. So I'm not washing my face tonight because I don't have any other product on there, and I definitely don't feel like scrubbing my face. So we're using 2 products here on the first evening. Now that most of the heat has dissipated, my skin is feeling better. We're gonna start with the Elastin Nectar. So this is Trihex technology. It's a peptide product. It helps to promote cellular regeneration and healing. And of course I have clean hands right now, but we're gonna mix some of that onto the skin. And I have found that this works really well post-laser procedures. Hit a lot of these dark spots pretty hard with the laser. Started with really high density right here on the dark spots, one here by the eye, a couple over here. And then I did another pass that was spaced out a little bit more. So I'm gonna let this dry on the skin for a little bit. A lot of times after resurfacing lasers, people are gonna use Aquaphor or Vaseline, and those will work well. They'll help to create an occlusive barrier, decrease water loss from the skin, decrease itching. but I prefer to use something called Dr. Rogers Restore Healing Balm. This is what I give to my patients when I do a resurfacing laser on them. I actually just give them this product. It's built into the price of the service, as well as some of the other products that we're going to use over the next few days. A lot of products from Aven, and I'll have a link for those down in the video description. But the Dr. Rogers Healing Balm is petrolatum free. Now, I'm not scared of petrolatum. I don't think that it's a problem to use petrolatum, but it's just occlusive, whereas this has glycerin in it, so it's actually going to help hydrate the skin. And then the occlusive properties here are given by castor oil and castor wax. So that is kind of the evening of the laser procedure. And this is essentially what I'm going to use the next 2 or 3 days. All right, so it is the next morning after the laser. You can see I've got a lot of we call these microepidermal necrotic surface debris here coming up off the laser, and I'm definitely swollen. You can see a lot of the swelling under my eyelids. I put another layer of Dr. Rogers Restore on this morning, because when you wake up, some of that is now on your pillow, and you don't want your skin to dry out when you're recovering from a laser. The other thing that's very important after you've done any procedure on your skin is sun protection. I don't want to get sun on the area that's healing, and I'm pretty good about sunscreen anyway, but you want to be careful about the sunscreen that you're using when your skin barrier is compromised. And so what I'm choosing to use this morning is Cicaplast Balm B5 UV from La Roche-Posay. So I love Cicaplast Balm B5 as a healing balm, as a healing cream. I give this to a lot of my patients who have rosacea, who have a compromised skin barrier, and it's going to be excellent to help keep my skin hydrated, but it has the addition of SPF. So this is an SPF 50 sunscreen. So I'm going to be putting this on before I go outside to play with my kids. This is a very thick sunscreen. This is not the kind of sunscreen typically I would use for a daily sunscreen, but it is an excellent sunscreen when you're healing. You can see it's very thick, white. It's not going to be the kind that I want to wear every day. You can see how white it makes me. I tell patients this is going to look and feel almost like a diaper rash ointment. I want to make sure my skin is well protected from UV while I'm healing. And also, it's going to help to heal my skin from the laser. And then I'm also going to wear a wide-brimmed hat when I go out, just to keep the sun off of me. And then after I'm back in for the day, we're probably going to wash my face just real gently with a really gentle cleanser. So this is the morning after the laser procedure. I'm gonna put a hat on and go outside and have some fun. All right, so it's still day 1 after the procedure, I guess day 2, but I've gotten out of the shower and I wanted you guys to be able to see my skin now that I've washed it. I used a Bioma oil cleanser, which is very gentle, fragrance-free on the skin, and it helped to remove all the, Dr. Rogers Restore that I had on there, the sunscreen that I had on there previously. So right now my skin feels very dry. It feels like sandpaper, essentially. You can see, little areas where I might have missed with the laser. And then these areas are getting nice and dark. I hit those a lot harder when I was doing the laser procedure. Every day, morning and evening, I'm going to be using the Elastin Skin Nectar product. So this product to help accelerate healing. And we're going to put this on the different areas. And I use a generous amount of it. This is bigger than the size you can normally buy, but it is a great product, and one regular size product will last you the entire length of time you need for laser recovery. I don't know if the microphone is picking up the sounds of me putting this on, but it sounds rough. It sounds like you're scraping your hand over fine sandpaper. I had a little sunspot coming up on the nose. I hit that area really hard as well with the laser. And I'm gonna let this dry, and then we'll do the Dr. Rogers Restore. Now coming in with the Dr. Rogers Restore Healing Balm. This is a little greasier, a little bit thicker, but it's gonna prevent water loss out of the skin a little bit better and help. So this is one day after the laser procedure, tonight before bed. I'm gonna repeat this exact process. I'll gently wash the face, I'll put on Elastin Nectar, and then I'll do Dr. Rogers Healing Balm, and you guys will get an update from me tomorrow on how the healing is going. I'll see you then. 2 days ago, I did the laser procedure on my face, and I am peeling a ton today. My whole face still feels like sandpaper, but a lot of it has started to come off, particularly up around the nose. I'm about to wash my face, and then we'll start putting some product on. So give me a second to wash my face, and I'll be right back. If you can tell on the camera, a lot of the flakes now here on the middle part of my cheeks have started to come off. Areas that I hit myself a lot harder up here on the nose
There's still a lot of peeling that will have to happen. That's going to take a couple more days. The spots on the side of my head, going to take a few more days. The forehead started to lift on some areas, but overall, a lot of healing going on. You can tell I'm traveling. I'm not in my normal bathroom today, so I brought my skincare with me, starting again with the Elastin Nectar. So a lot of the general redness in my face is gone now, still pretty red on the nose and a little bit on the forehead. The next thing that we're gonna do is I'm not gonna use the Dr. Rogers ointment this time. At nighttime now, I'm gonna be using the Cyclofate Plus cream. This is from Aven. This is part of the SOS kit that I give patients after they have a laser procedure. So when we've had a couple of days, depending on the depth of the laser, when you've had a couple of days of Dr. Rogers Restore and you want to move on to a cream, this is the one that I have my patients use. My laser wasn't the most aggressive that I could have done, but I didn't want to do any harder when I was just doing it myself, and I couldn't do more aggressive numbing on myself. So now that we let the Elastin sit on the face for a minute, we're going to go ahead and put on the Cyclofate cream. Very similar to the Cicaplast from La Roche-Posay. This is a very thick cream. Almost even more so looks like a diaper rash ointment. So as we put it on, it's going to be very thick, and then it'll start to rub in. And I'm using a generous amount. I want this to last all night while I'm sleeping. And then I'm probably going to do just a little bit of slugging after this, maybe with some Vaseline, because I don't think I actually brought the Dr. Rogers with me. So that is day 2 after the laser. Let me know if you guys have any questions thus far. Tomorrow you're gonna see me on day 3. All right, we are 3 days after. I just got out of the shower. I used the CeraVe Hydrating Cream to Foam Cleanser, and a lot of sandpaper feeling still on my forehead. More stuff has rubbed off overnight. The nose still has a bit to go. And my morning skincare routine, I'm not gonna bore you with showing you that I put everything on, but I'm just gonna walk you through what I am gonna use this morning. I'm gonna be going out with family to do some stuff. So again, we're starting with the Elastin Nectar. This is the repair product. And then for my sunscreen today, because I am gonna be out and about, even though it's winter, a little bit overcast, still gotta protect the skin. So we're going back to the Cicaplast Balm B5 UV, day 3. You can kind of see what's going on the different areas here. Skin feels a little dry after the shower. So we're gonna hydrate. 4 days after the laser procedure now, a lot of stuff has now sloughed off the face. Still a little bit sandpapery on the forehead and my nose. I hit that probably harder than I thought that I did, but a lot of red stuff there that is still gonna have to flake off. Probably still gonna take another 3 or 4 days on that, but things are coming off really flaky over here on those spots on the side of the head that I hit hard. So seeing a lot of progress. We are gonna be going out and catching up with some friends. I'm back in my hometown right now. So morning skincare routine today, somewhat similar. We're starting off with the Elastin Skin Nectar. You guys have seen me put that on before. But then I'm gonna go with a little bit more cosmetically elegant sunscreen. A lot of the areas of my face, the skin barrier has repaired, at least at deeper levels. And so I'm not so concerned with putting on like Cicaplast right now. I'm gonna be using UV Restore from Elta MD today, just because this is gonna be a little bit more cosmetically elegant, but it's still a very moisturizing, very hydrating sunscreen. It's a physical sunscreen with zinc oxide, but it has natural squalane in it. So it is gonna hydrate very well. Now, before we put on the sunscreen, I'm just gonna mention, I get a lot of questions on what I shave with, what I shave my head with. So the thing that I use the most is the Bronze Series 9. This, I've tried a few different electric razors for the top of the head. This one gives me the closest shave. And I've used, razor, obviously, like a Gillette razor or something works really well. It just takes more time, and I usually don't want to spend that much time, but once a week or so I will use a Gillette razor on there. But the Bronze Series 9 is my go-to staple. So I think you can tell that this is just a little more sheer than the Cicaplast UV, but still has just a slight white tint to it. So this is day 4 post CO2 laser with the Helix, which is CO2 N1570, and we are ready to go out the door. All right, traveling now, and just washed my face with the Bioderma cleanser that I featured earlier in the video. We've got a little bit of stuff still on the nose, but it's finally starting to come up. Still a little bit of the dark spots there on the side of the scalp. Today's routine. I'm traveling, and the Elastin Nectar that I have is too big for TSA, and I couldn't carry it on. So we're just going super gentle. We're moisturizing now with Cyclofate.
and then probably slugging with a little bit of Vaseline at the end of the day. But this is 6 days out from the laser. Tomorrow will be 1 week, and then I think I'm gonna need just a couple extra days just to finish up the nose and a couple of spots on the forehead that you can kind of see where we're at now.
Hopefully that was instructional to you guys as you saw what the CO2 laser treatment looks like and what the recovery looks like. This is something that I do a laser treatment on my face about once a year. This was my first year with CO2. I've been incredibly happy with the results, and you maintain those results best by using a sunscreen every morning. I use retinol at nighttime, I use vitamin C in the morning, and whenever my skin gets dry, I use a good moisturizer like that Fake. And the products that I used are gonna be linked down in the video description. Remember, when you guys use or purchase any of the products down from my videos, or just watch, like, comment, subscribe, share these videos with a friend, it helps to support my mission of providing free dermatology care to underserved populations. We go out and provide free dermatology care in my mobile clinic. That is a passion project of mine. So thank you for supporting that, because I'm going to continue to keep doing it and just funding it myself. So thank you for your help, your support, and I'll see you guys on the next video.